In Lehi, Utah, the Groom family, parents Heather and Brent, Sophia, Carter, and Andrew, catch up on the day's events. Heather tries every night to find a meal that works for everyone. But that's not as easy as it may sound. The reason? Acid reflux disease.
Dinner time has been such a challenge because we never really know really what to make to please everyone and make it a positive experience.
Heather's 3 children have varying degrees of acid reflux, officially known as gastroesophageal reflux disease, or GERD.
I kind of get sick and I taste something in my mouth. I tried to go back to sleep, but I laid down and I started throwing up.
With our baby Sophia, when she was born, we were at the hospital and she started spitting up. I am surprised it's in all 3 children. You know, I remember even one of my doctors saying, you know, I've never seen a family 3 for 3 for reflux.
In the past several years, there have been a number of research studies suggesting that GERD may be an inherited disease. The genetic relationship is still being researched, but physicians may need to take a closer look at good documentation of family history of acid reflux when making a diagnosis of the child with suspected GERD. Doctors say parents are often confused and frustrated.
The parents' lives are affected because they have a child that they can't comfort. And if you have a child who's irritable, who has behavior problems, who doesn't sleep well, who doesn't eat well, you would like to uncover a cause for that and get that treated if you can.
In toddlers and older children, recurrent reflux can be triggered by certain foods, beverages, overeating, obesity, and medications. Prescription medicines are available to treat reflux disease in all age groups.
Many of the strong acid suppressants are very, very safe for children. They've been studied and given to toddlers and school-aged children daily for up to 11 years. There have not been significant complications with these medications. When Andrew was very young, he had a lot of pulmonary symptoms and feeding problems, ruminating, spitting up, and we treated him intensively daily with acid suppressant medication. We were very careful about his diet, so intermittent treatment for his symptoms seems appropriate for him. Don't move your head, follow my finger with your eyes. Over. We'll also look to a time where Carter is treated just intermittently. Say, ah.
Pediatric GERD can be a complex condition for both children and their parents. For larger families, or those with more than one child affected, a trial and error approach with food may help make meal times a bit easier.
I'd like to say that every dinner goes wonderfully and everybody's happy, but it doesn't. And I think one thing that we're trying to teach our children right now is just to express the positive things about dinner and things that they like or things that they enjoy. Bless us to remember others and to serve other people well.
The children have their favorite foods, and Heather is thankful that she's found a routine that works, combining lifestyle changes and medications. She feels comfortable at night knowing they are on the right track.
Good night.